Hi, my name is Andrea Leonard. I'm the president and founder of the Cancer Exercise Training Institute, and I'm a 38-year cancer survivor. And since my mom's first cancer diagnosis when I was 15 years old, cancer has been a part of my life. Now, of course, nobody would choose that, but I do believe that certain things are our calling, and cancer has been mine. After my mom's second diagnosis of breast cancer in 1995, I was a new personal trainer. I was training for about 5 years. I was the director of personal training for a large YMCA. And my mom asked me if I would help her in her recovery. The first time, she was not told about lymphedema. She was not told to move her arm and ended up with a frozen shoulder, endured, I wanted to say months of painful physical therapy, but it's actually gone on for decades. They removed too much tissue, did not leave large enough flap. She had complications from that and had to have her implant removed. She's had chronic pain. And to make a long story short, she didn't want to have to go through that again. So I was fortunate enough to be training her breast surgeon, Catherine Alley, and I said, what do you think about writing a book on exercises for breast cancer survivors? Now, this is in 1995. There was virtually nothing out there. There was no research. The internet had just started. And Dr. Alley said, absolutely, that's a great idea. This is a huge unmet need. So we spent 3 years working with some of the most amazing surgeons and the chiefs of breast surgeons at Georgetown University, George Washington University, and Johns Hopkins. And we wrote Essential Exercises for Breast Cancer Survivors. Now, that was published in 2000, and shortly thereafter, my dad was diagnosed with prostate and bladder cancer. What this did is it made me realize there was an even larger, unmet need. All different types of people that were dealing with different types of cancer all around the world and didn't know what to do after they were diagnosed, after they had gone through treatment into their recovery. So I started the Cancer Exercise Training Institute in 2004, and I created an educational platform where I could train health and fitness professionals around the world to work safely and effectively with cancer patients under the title Cancer Exercise Specialist. We have now trained over 15,000 people in over 50 countries, and I am proud to say that our coursework is the most comprehensive, up-to-date, current evidence-based material in the world. And I want to share a little bit with you today about how you can incorporate exercise as part of your healthy anti-cancer lifestyle. Because we all are afraid of, hearing the word cancer for the first time, and perhaps more afraid to hear it the second or third time. As a 38-year cancer survivor, I often think that, what if I have cancer again? And it's normal. It's perfectly normal. We can't control that. But what we can control are our lifestyle choices. We can eat a healthy, more plant-based diet, high in grains, high in fruits and vegetables, avoid alcohol, get adequate and quality sleep, manage your stress levels, do something you love every day, and exercise. Not only will this help you to prevent future cancers, but this will also help improve treatment tolerance, minimize treatment side effects, improve your overall quality of life, which is huge when you are really struggling to work your way up from the bottom. It's going to help speed your recovery. We're going to help regain your range of motion, correct muscle imbalances that are the result of surgery, radiation, any other types of treatment. And maybe most importantly, study after study has shown that people who exercise following a cancer diagnosis have a longer life expectancy than those who do not. So I don't need to say any more, do I? Are you ready to start exercising and making it a part of your daily life? I'm going to share with you some basic tips on how you can incorporate exercise into your lifestyle. Now, for those of you who have not been exercising at all, or perhaps you've just been released by your doctor to begin to exercise, and you're saying to yourself, okay, well, my doctor says yes, but does that mean I can go climb Mount Kilimanjaro, or can I participate in a marathon, or does that mean I should do yoga? And I can't give you the exact answer to that because it's a very comprehensive assessment that we as cancer exercise specialists conduct prior to prescribing individualized exercise programs. So what I'm going to share with you today are some very general exercises that just about anybody can do. And it will at least get you started. And from there, if you would like to find a cancer exercise specialist near you, you can go to our website, which is www.thecancerspecialist.com. And you'll see a directory on the bar at the top of the page, the search bar, and you can just put in your postal code and find someone near you. And if you can't find somebody right near you, we have Zoom now. So I have people all over the world that can come into your living room via your camera or your computer, and you can get that individual attention that we all need and you absolutely deserve. All right, so if you are currently undergoing treatment and you are suffering with extreme fatigue, which is the most commonly reported side effect, it's really important to listen to your body. Now, exercise and the endorphins that you will produce will actually give you that much needed energy, but the key is not to do too much too fast. So I'm not suggesting you get on your bicycle and you go, ride for 30 miles. Not at all. We're going to start off with the very basics, and that is just moving. So I don't care if it's 1 minute, an hour, and you set a goal to climb the stairs 3 times, or you're just simply going to march in place and get your arms overhead to raise your heartbeat. You can change your leg movements, moving from side to side, moving forward and backward. And that's really important also because how many of you have chemo brain or short-term memory loss following chemotherapy, or even after anesthesia? The longer you're under anesthesia, that can affect your memory as well. So try some different drills, and I'm going to back the camera up so you can see my full body, and I'm going to show you some basic cardiovascular drills that you can do to not only strengthen your heart and lungs. It's kind of fun, do a little aerobic exercise, a little dance. And you know what, just the moves that I'm going to show you, you can expand on that. You can just dance like nobody's watching, but we're going to do it in a pattern so that we can train your brain at the same time we train your body. All right, so make sure that you clear away enough space so that you are not tripping over anything. If you have peripheral neuropathy, burning, tingling, numbness in your feet, you want to avoid any risk of tripping or falling. So certainly look at your environment. And I wouldn't recommend walking on a treadmill unless you are holding on or you have somebody standing by to assist you if you lose your balance. Make sure that you have permission from your doctor before beginning this or any other exercise program, and work within your limits. You should always feel more invigorated when you're done with an exercise session. You should never feel more fatigued. Now, if you have had vomiting or diarrhea within the last 24 to 36 hours, I suggest that you just take a day or two to rest, rehydrate, and replenish your electrolytes before you exercise. We're going to start off with some basic fundamentals. Okay, just about anybody can do this, and you could always modify this. You can increase your intensity, you can increase your arm and leg movements, you can increase or decrease the speed, whatever is comfortable for you. Put on some fun music and just have fun. There is nothing that you need to do perfectly. Just get your body moving. So let's start off with just marching in place. Now, if you don't use your arms at all, you can work at a much lower intensity. As you pump your arms, it's going to get your heart rate up. And then, of course, if you get your arms going up over your head, it'll really get your heart rate going. So you can regulate that as you feel comfortable. Let's say I pick a random number, which I've already done more than 8, but I've done 8 steps. Next, I'm going to add on heel digs. So I'm going to just push my foot out, and I'm going to do 4 of these on each side. 3, 2. Now I'm going back to marching. So 1, 2, 3, 4, 5, 6, 7, 8. Heel dig, heel dig, heel dig. Good. 4 more of these. And now we're going to add on something new. All right. So maybe I'm going to go back. 2, 3, 4, 5. Now, if my arms are tired, I just put them at my side. And we start from the beginning. 2, 3, 4, 5, 6, 7, 8. Heel dig, heel dig. Okay, like I said, I'm just using the magic number 8. Last 2, now we go back. I can change my arm movements a little bit, working the back of my arms. And 4, 3, 2, now I'm gonna add a side step. Step together. You could do whatever you want. You could do like a chest fly, and then I go back to marching. If you're feeling yourself getting out of breath, then forget the arm movements. Okay, back to heel digs. Even I'm getting a little breathless. Of course, talking while you're doing this doesn't help, right? Now to the back. We push back. You can take those legs a little further back if you want to do almost like a lunge. Okay, now side step, side step, side step. I can just do this. What should we add next? Let's do a knee up. Knee up, knee up. Same thing, I can leave the arms out. I can switch them over. Now back to marching. Nice deep breaths. If you need to take a drink of water at any time, go right ahead and heel dig. Now notice I'm repeating this pattern and I keep adding something on. So I'm challenging myself mentally and physically. 4, 3, 2, now we go side step, step together. Good, can add those arms back in. 4, 3, 2, now to knees. I'm gonna do a little opposite. Now, if you're working on your range of motion, particularly following breast cancer surgery or treatment, last 2, now we're gonna do a little front kick. Then listen to your body. You wanna keep improving your range of motion, last 2, and back to marching. But you don't want to do anything that causes you pain. 4, 3, 2, and heel digs. So hopefully you're getting this, you're following along with my pattern, and some of you may already be tired, and that's okay. I think I'm doing 2 extra, but that's all right. Now we'll go back. I'm gonna push my arms a little harder, push my legs a little further back. I'm getting my heart rate up, and now to the side, good. You got this. 4, 3, 2, give me those knees. You could do opposite elbow to opposite knee. You play with it, have fun. Okay, and the little kicks. Let's go a little higher. What should we do next? 4, 3, 2, 1. Let's add a little twist. Now I don't even need to lift my feet off the ground. I'm just twisting on the carpet. And then we go back to start. Last round here. 4, 3, 2, and 1, and back. I switched it up on you. See? No, there we go. So I even screwed up, and that's okay. We just go back to start, okay? So here we go, because my mind needed some practice. 4, 3, 2, 1, and heel dig. You know what? All of us make mistakes. We all forget things. And I'm just showing you I am no better than and no worse than anybody else. Let's do 2 more of these. And side step. And to be honest, although we do want to try and get the sequence right, if you do a few extra reps, no problem at all. All right, now knees. Boom. Give it a little slap. And 4, 3, 2, and 1, and kicks. See how fancy I can get here. All right, and then our twists. Now I'm gonna finish with jumping jacks. So you could do full jumping jacks, or you could do modified jacks. 4, 3, 2, one more time from the top. Ready? Here we go. Heel digs. Push those legs back. Push the arms back. You got this. Hopefully you're feeling energized. Good to the side. Step out. Step out. Nice deep breaths. Don't hold your breath. And knee. Front kick. If you're getting tired, just drop those arms. Okay, and twist. You can go harder, you can go softer. And then finishing off with jacks. 4, 3, 2, and 1. Now just walk it off. All right, you want to let your heart rate come back down. Don't just stop cold turkey, because it's like a train going full speed and going right into a brick wall. So slowly take it down. You can even walk around the room. Do whatever you need to do just to cool down. And next we're going to go into some functional fitness exercises. Stay tuned. If I asked you if you were able to do a squat, what would your answer be? Many of you will say, no, my knees hurt, my hips hurt. No, I can't do that. Well, I beg to differ, because if you get on and off of a toilet, if you get in and out of your car, if you get up and down from a chair, guess what? You're squatting. So let's learn how to do a proper squat. Really important that when you look in the mirror, if you see your knees that are kind of caving in like that you correct it. So maybe you can set up a chair right in front of a mirror so you can see your form. And you want to make sure that your thighs are parallel, that your feet are parallel, and everything is going forward. So I'm going to show you a couple different angles here. And I know you can't see my feet, but focus on my thighs. And you want to begin with your arms up. Now, many of you will not be able to do that, in which case I'll give you the option of putting your arms across your chest. But try with your arms up, looking straight forward. Don't look down, don't look up. And I want you to sit back with the chair behind you. And as you're coming up, you're going to start the movement through your heels. You're going to push through your heels. Then you are going to squeeze your butt cheeks like you're squeezing a dollar bill between them, okay, as you're coming up. So we're engaging those gluteal muscles. So you're going to inhale as you go down, exhale as you go up. Now, if you notice that you're bending forward like this, that's a good indicator that your chest muscles and your lat muscles are tight, which is very common following a mastectomy, following radiation, any number of things. It could be from working at a desk all day. So try some very basic stretches. Keeping your head stacked and aligned. Simply squeeze your shoulder blades together. Take a nice deep breath. Squeeze a little further and relax. Squeeze back each time, trying to go a little bit further. And if you can do that with no pain, then the next thing you could do is go into a door jamb, and you'll want to step forward and lean into that door jamb. If you need to lower your arms, that's fine. We don't want any pain here, okay? But roughly, at 90 degrees, a little lower. And don't let your head lead the way. So you're going to step through that door jamb, and let me get a little further back. You're actually bending the knee, and then breathe. And try and hold that stretch for 30 seconds. And that's going to be a nice chest opener. You could also be lying on the floor. You could lie over a Bosu balance trainer or a foam roller and just let your arms open up. But equally as important is to contract your shoulder blades as if you're squeezing a tennis ball between them. So we're stretching the chest, and simultaneously we're strengthening the back musculature, okay? So that being said, if you're having a hard time, your arms are falling forward or they're falling out to the side, let's try it just like this. Now I'm gonna back up this chair a bit. So hopefully you can see a little more of me, okay? Notice my thighs are parallel and I'm just sitting as low as I can. Inhaling down, squeezing my tush as I'm coming up. And if you do 3 and you're exhausted, guess what? Whew, you can just sit down. That is perfectly fine. Maybe do a little stretch while you're resting. Or just open up your arms, your chest. Take in some nice deep breaths. And that's going to bring me to my next point, which is lymphatic drainage. Now I'm going to come a little closer to you here. I don't like to be so far away from you. Okay, if you have had lymph nodes removed or irradiated, you are at risk for lymphedema. So our next part of this is going to be lymphatic drainage exercises. All right, get yourself seated comfortably. You can do this on a nice comfy chair. You can do it on a fold-up chair, your couch, sitting on the edge of your bed. You choose whatever you're comfortable with. And we're gonna start with some deep diaphragmatic breathing. Not only will this lower your heart rate, lower your stress response, but it is going to help promote lymphatic drainage. When you've had nodes removed or irradiated, I make the comparison to the highway or the freeway. If you had 4 lanes of traffic every morning between 8 and 9 a.m. and you had 1 million cars going down those 4 lanes of traffic, what would happen if you shut down 1 lane of traffic? Well, naturally, there's going to be a bit of a backup. So we start to get a bottleneck. Now, if we were to shut down 2 lanes of traffic, then you start to see a substantial backup of traffic, and so on and so forth. So the greater the number of lymph nodes that you have had removed or irradiated, that will increase your risk of lymphedema. Now that is the swelling of the extremity, or it could be your torso, following removal of or radiation to the lymph nodes. The risk ranges anywhere from 6%, having a sentinel node removed, to upwards of 30% when you couple a full lymph node dissection with radiation. And obesity increases the risk, as does the aging process, which of course we can't help, and poor nutrition. But you can control your nutrition and you can work to improve your body composition. This isn't about body shaming. This isn't about fitting into your wedding dress from 30 years ago. This is about your health. And not only does having a good body composition decrease your risk for lymphedema, but it also minimizes your risks for heart disease, for diabetes, and for future cancers. And these can all be side effects or comorbidities of certain cancer treatments as well. So if you're currently going through chemo, radiation, or hormonal therapy, please seek out a registered dietitian who specializes in oncology, because there are certain foods and herbs that can interfere with the efficacy of your treatment. So please be careful when it comes to choosing somebody. Otherwise, incorporate exercise, reduce your stress, which will help to reduce your cortisol levels, and then deep breathing will play a big role in that as well. All right, we are going to start off with deep belly breathing. Now follow along with me. Place one hand on your belly and one on your chest. And what we're going to do is we're going to take a nice deep inhale and feel our belly expand against our hand. And when we can't bring any more air into our belly, then we're going to inhale it up into our lungs, hold it for a second, and then very slowly exhale. We'll do this a couple times. All right, you ready? Now you can breathe through your mouth or your nose. I vacillate between nostril breathing and mouth breathing. Here we go. Watch my hands. So see how my belly pushes out. Now my lungs. I'm going to do one more. Now, I would recommend probably doing 10 of those. The more, the merrier. It's certainly not going to do any harm, and there are so many benefits from deep belly breathing. Now, once we have done that, we're going to go through a series of lymphatic drainage exercises that are designed to open up the thoracic duct, which will help to drain fluid not only from your arms, but will also help with the torso and lower extremities. So there's a bit of a sequence that we're going to do that includes some neck stretches, which will also alleviate any tension that you may have. If you're at a computer all day and you've got forward head, rounded shoulders, this is all going to be very beneficial for you. All right, so let us begin. Let's start with some isometric chest presses. Now, what you're going to do, and you can keep your arms down here, you can raise them up, is simply press the palms of your hands together and squeeze your armpits like you have bananas under your armpits, and press for 1 Mississippi, 2 Mississippi, 3 Mississippi, and relax and repeat. Now, I usually recommend that people do these each about 6 to 8 times, but it's really up to you. So I'm going through and I'm pausing in between these. If you can do 8 to 10, that's great. If you can only do 2 or 3, that's great too. So just for the purposes of speeding this up, I just did that 4 times. Now I'm going to do isometric back squeezes. If you can't raise your arms up here, which many of you will not be able to do, then you can simply retract, push your shoulders back, and squeeze that imaginary tennis ball between your shoulder blades. Make sure you're pulling your belly button in so you're not arching your back. And you're going to squeeze your shoulder blades together, so it can either be like this or just squeezing back like that. And then relax. Squeeze back. Relax. Squeeze back. Don't forget to breathe. And let's do one more. Excellent. All right. Next, we're going to raise your arms out to the side. And we're going to start by just rotating your hands. Just up and down. Now, if this is too painful and you can't keep your arms up, that is okay. You can skip this or just do 1 or 2. And from there, we're going to do some little arm circles. We'll go clockwise and we'll go counterclockwise. Okay, so we're getting everything moving, warming up our bodies. Next, we're going to do some neck stretches. So we're going to take one arm, and if you can, you're going to place it behind your back. Now, you may not be able to do that, and that's okay. You can hold on to the bottom of your chair or even the side of your chair, but keep this shoulder depressed, which means down. Now, tilt your ear to your shoulder, and without pulling on your head, just put the weight of your hand on your head, and you should feel this nice stretch through here, opening up. Focus on your breathing. Now, although we're going to do this pretty briefly, I want you to try and hold these for 20 to 30 seconds to maximize the benefit of the stretch. Now, watch how I subtly change my head and my neck angle. I'm going to turn my chin to my armpit, and now I'm going to put my hand on the back of my head, keeping this arm pulling down so I've got that counter stretch there. And breathe. You can close your eyes. This should be a nice, relaxing experience for you. And then we'll go ahead and do the other side. So this arm down, if you can put it behind your back, that's great, but keep that shoulder down. Tilt your head to the side, just the gentle weight of your hand, and you want to feel that nice stretch through here. You can feel it opening up all those pathways. And breathe. Okay, now turn your chin to your armpit, put your hand on the back of your head. Make sure this arm is staying down. And you may feel one side more than the other, which simply means you're carrying more tension on that side, or perhaps you have scar tissue or adhesions. Lastly, we're going to tuck our chin to our chest and just the weight of your hands on the back of your head. All right, now we're going to let gravity do its thing. You're going to raise your arms overhead. And if you can only raise your arms to here, that's okay, if that's the best you can do. But we're going to work to getting our arms all the way up. So what we're going to do right now is we're going to start with wrist circles. And once again, we'll go clockwise and counterclockwise. This chair's really comfortable. I could fall asleep in it. So then I'll go the other direction. Perfect. Next, like knocking on a door, flexion and extension. So what are we doing now? We are kind of pumping that fluid back towards our torso. And we're going to finish off with fist clenches. From there, you're ready to participate in whatever exercises you'd like. It's really important though, if you are in that risk category of somebody who's had lymph nodes removed or irradiated, that you begin each exercise session with a little warm up, at least 5 minutes of cardiovascular exercise, your deep breathing, and then the lymphatic drainage exercises. Now, if you're at risk for lymphedema on your upper body, you have no limitations on your lower body in terms of what you can do. You can ride the bike, you can do weights. Obviously, it's important to address any muscle imbalances and work on correcting them. That's where a cancer exercise specialist can help you. But if you're at risk for lymphedema on your lower body, then you have no limitations in your upper body. You can do all kinds of weights. You can play tennis, you can play football, you can do golfing, but you want to start and progress slowly with your lower body. So I hope these fundamental exercises will give you a place to start. This is not intended for you to do this forever. You must continuously challenge your body so that you continue to invoke change, and always work at your own level. Don't push yourself too hard. Don't ever push yourself to the point of pain. Thank you so much for watching this presentation, and I am honored to be able to participate and be a part of this virtual conference coming to you from Oregon in the United States. Once again, I'm Andrea Leonard, president and founder of the Cancer Exercise Training Institute and 38-year cancer survivor.